For our housekeeping items, now I'm going to hand things over to Angela Rapp-Kennedy, who is CQL's Vice President of Special Projects. Angela?
Hi, thanks, Seth, and welcome, everyone. I was glancing at the registration. We have folks from around the globe and around the time zone. So it's either good morning or good afternoon or good evening. So I appreciate you all logging on and look forward to a quick hour together. What we found to be most useful is I'm going to turn off my video while I'm going through the slides, and it's less distracting for folks. And then at the end, when we're chatting, then I'll come back on and turn that video on. So you're here to talk today about human rights committees. Most of you, or many, I guess I should say, probably join us for a variety of our activities. And so I made the decision not to include our history video. Some of you probably have it memorized and could recite it back to us. So just wanting to make sure that you know it's available, and Seth will drop a link in the chat box if you are not familiar with that video. Really encourage you to it's a 6-minute video. Gives you a good picture of CQL and our history. What's most important to, especially this conversation, as much as all of our work, is our vision and mission about dignity and opportunity, and an opportunity for community for everyone. And that we do that through our dedication to define what quality of life looks like, to figure out how to measure it, and help people make improvements in that. So today is about human rights committees, but before we go there, really need to stop and do a quick overview to talk about rights. Since the substantial reason for having a human rights committee is to talk about rights restrictions, I want to make sure we're sort of on the same page with what we're talking about in terms of rights. So just some very basic foundational concepts. Everyone has rights. And so those are what we're going to be looking at today, and what we talk about when we're talking about rights restrictions. And rights are a legal obligation, and they can't be limited without due process. And so that's the whole point of our conversation today, is to talk about the Human Rights Committee and how you can use that as your due process mechanism to ensure that people's rights are not being limited without them having a voice. And we're going to talk a little bit more about due process in general after we talk about rights. And of course, we always want to make sure, as many of you remind us when we talk about rights, rights have associated responsibilities. And if we're helping people learn about their rights, we need to be helping people learn about that whole picture of rights and responsibilities. And it's especially important for the folks that you are potentially supporting who have probably limited life experiences, that you're really going to need to put in some time and effort to help them with those concepts. So let's just run through the kinds of rights that we're talking about. And Seth is going to drop some links into the chat box. We draw our list from the US Constitution and Bill of Rights, from the UN Declaration. These come from countries and states and provinces and counties laws that are in place. You'll see that it comes from the HCBS settings rule here in the US. So a wide swath in terms of what we're looking at with the rights. So just a quick walkthrough: rights to access the courts and legal representation. And one of the things I always think is helpful as we talk about the rights is to think about how they apply to you and how you maybe have exercised them, and then be thinking about a person or people that you support, how it might look for them and how they may have exercised them. So rights to access the courts and legal representation could be, going to small claims court, or it could be things like guardianship. So there's lots of court related. The right to free association. So this is really about being able to hang out with who you want, when you want. And again, real important for you to think about what that looks like for you and what that might look like for some of the folks that you're supporting. The right to contract, to own, dispose of property. The right to equal educational opportunities. So people have an opportunity to access education at whatever point they might be in life. To equal protection under the law. The right to due process, and we'll talk more about that in depth. The right to freedom from cruel and unusual punishment. I think you would do well to think about what that might feel like, how somebody might describe that. The right to vote. And this is one that we do better than some of the others in the service system. And it goes beyond just voting, it goes beyond to participating in the whole political process. So helping people understand their rights related to registering and being able to vote also includes, do you want to participate in a candidate's campaign and do some work or advocate for different bills and legislation? The right to move freely. So the right to move freely is all about within your home, within your community, to come and go as you please. The right to manage your money. The right to know that it is your money, that you have a way to decide what you do with your money and a way to access your money. The right to send and receive mail, the right to make and receive telephone calls. And when I think about telephone calls, you have a right to make and receive them, but you need to have a telephone in order to be able to make telephone calls. And so thinking about that, the right to visit and be visited by whomever you choose. This gets at people have the right to have friends and family come into their home and for them to go into the community and spend time with people who they would like to spend time with. Accessing their personal possessions, the right to marry and have children. Again, this is not necessarily something we talk a lot about. We really need to help people understand they have the right to think about that, explore that, figure out what that might look like for them. The right to freedom of religion, and that's the right to decide if you want to practice a religion, the right to practice whichever one you want, not just the one that perhaps the staff who's on duty during this shift goes to, really being able to explore options. The right to a reasonable expectation of privacy. And this is especially important when people are receiving 24/7 supports in their home, and how are we as supporters helping them have the privacy that's important to them? And how do we know what is important to them in terms of privacy? I mean, you all probably have friends who are very open in their homes and other people who are very, very closed and very more circumspect about what they share with people. And privacy is physical privacy, information privacy, all sorts of things. The right to services in the least restrictive environment. The right to freedom of speech and expression. And in order to act on this right, you have to have a mechanism to be able to express yourself. And for many people that we support, that may not be using words. And so what is it that we have in place to make sure that people are able to exercise this right in terms of supporting various ways for them to communicate? The right to life, liberty, and security of person, to equal pay for equal work. Before you worry about equal pay, you actually have to figure out how to have a job and how are we doing with that. So ensuring that people have a right to explore work and be supported to act on the options that might be available to them. And then, of course, their pay being, certainly for us, we would talk about equal pay would certainly mean at least minimum wage and above. And then a right that doesn't get talked a lot about, the right to bear arms. This is a right that people have, certainly in the United States, and different states have different restrictions on that. But we need to know that the people we support come from a wide background, and you may be supporting people, you may live in a part of the country where hunting is very much a part of the social fabric and of the fabric of this individual's family. And so how are you helping them be able to have options and participate in those sorts of activities if that's something that they would so desire? And then these kind of rights, the right to have a say in what you eat and when you eat it, when or where you eat it, the right to decide when you're going to get up, when you're going to go to bed, the right to decide what you're going to wear today. And that's certainly, those kind of rights are very top and center in the HCVS settings rule in the US. So, you know, this is a long list of rights, and we have not certainly exhausted rights by any means, but just wanted to have sort of that picture of what we're talking about in terms of due process, because that comes into restricting rights. So due process, let's talk about that. So due process is basically an independent review of limitations to your personal freedom. So to these rights that you are due, then if somebody is wanting to limit them, then there needs to be due process for that. It's important in the concept of due process that people are treated fairly. And that is a concept that is embedded in the personal outcome measures that CQL, the tool that we utilize and help others utilize. And one of the outcomes is around being treated fairly. And some PALM data that we pulled, when you look at being that outcome, only about 50% of the people had that outcome present. And probably not surprisingly, given that statistic, only about 50% of the people had those supports in place at the organizations or where they were being supported. So only 50% of organizations were supporting people in a way that they would have their outcome of treated fairly met. And just to sort of build on why that's important, I just had a couple of data points that I thought were very important. So when people with disabilities are, they're 16.4, so about 16 times more likely to actually be treated fairly when the organizations that are supporting them actually ask information about rights violations or about how they're being treated. And then they're almost 34 times more likely to be treated fairly when there are actual procedures in place and people understand what those procedures are in terms of due process. And people with disabilities are almost 50% more likely to be treated fairly when the organization has policies and procedures that are in line with due process. So those are just a few tidbits to highlight how important it is to have due process, to have some mechanism for that in your organization. Due process is all about that there's a set of rules and principles, and that you need to go through a process in order to ensure people are being treated correctly. It's having an opportunity to disagree, to have input into this decision. And it's a legal requirement that states or the government, whatever that might be, has to respect the legal rights that are owed to people. Being a person with a disability does not do away with the fact that you are entitled to the rights that other citizens are entitled to. And the whole idea of due process, and certainly human rights committees, are about how can we protect folks from having their rights restricted unduly and unfairly and not necessarily. So we have a quick poll that Seth is going to launch. How many of you, right now we've got 372 folks, how many of you have a human rights committee at your organization? Oh, you're good voters. Good job. Okay, we're slowing down. We did great. So certainly a preponderance of folks. Seth, if you want to publish that so folks can see. So about 85% of you have some sort of human rights committee. 12% of you say no. And then there's a few of you that don't know. Great. So I appreciate that, Seth. Good context to put this in for folks. So if you will take down the results, Seth, that would be great. It's not going away on my screen. Is it going away on yours?
It took a couple clicks. It should be gone now.
Okay.
Sorry about that.
Okay. So let's launch into what we're all here to talk about today. What is a human rights committee? So it's a group of people. So it's a group, and it is people. The intention is to protect and promote human, civil, legal, service rights of people. And it's intended to serve as an advisory body to the organization. It is a place where the organization can have potential rights restrictions reviewed. The goal of a good human rights committee should be to help the organization ensure that people's rights are protected kind of across the board. So it should be a resource. It should go beyond just reviewing proposed restrictions and signing off on them. And it's a way for the organization to really consider rights in a bigger way and to help them look at how that might impact the organization. And so it's really a way for the organization to catch things that might be going on that perhaps leadership is not aware of when things come up to the HRC. Those are all reasons that you would want to have an HRC. So what are some other ones about why you would want to have an HRC? It's to comply with some federal laws, potentially, might be to comply with state or county or provincial requirements. If you are a partner with CQL and are accredited with us, it's an expectation of CQL through the basic assurances and the accreditation process that there be a human rights committee. And basically, it's just the right thing to do. It's best practice. It's going to help increase the quality of your services and the quality of life for the folks that you support and care about. So here's another poll, another question for you. Who of you has been or is currently a member of an HRC? Okay, I think we're kind of slowing down. So Seth, if you want to close that out and share the results with us. So about 70-30. So quite a number of you have had that opportunity. And so I'll be looking forward to hearing some thoughts from you a little bit later. And for those of you who haven't, hopefully you'll gain some insight from your time today. So what does that membership look like? So you want to have a diverse group of people, and we would say at least a third to a half of the members of the committee should not be affiliated with the organization, should not be employees of the organization, not have other connections. And again, these are all, best practice. Some of you might be in process, and we'll talk about some of the things that you can do to help with that. You want to include people who receive services. So you need to think about that, how to do that. In order to have good members, you need to provide training and mentoring, and we're going to talk about that a little bit. It's really nice to have somebody on your committee who's knowledgeable about different psychotropic medications. Pharmacists, doctors, nurses, those kind of folks can really give some unique insight. It's very helpful and going to serve you well if you can find some members who you feel are knowledgeable about best practices in the IDD field. Some ideas about where you might find some of these great committee members. You might recruit some students from local colleges or higher education. You might look for folks at another kind of social service agency. You might actually share members with other providers, and certainly you might want to, or you might need to be having a shared HRC. If you're a little provider, that might be another potential remedy for some of your issues. And you're going to want to make sure that you've got plenty of people, because everyone's lives get busy, and you want to make sure you've got enough folks there when you need to be voting on things. You might recruit from various community religious groups who might be interested and motivated to be supportive in this way. In terms of membership, you might actually have two committees who meet at different times, if that is an issue. And we're going to talk about meetings, about when you should have those. And you want to make sure that the liaison from the organization is really a strong advocate and is going to be a good support to the committee and really kind of push them along. So some of the roles and responsibilities, one of the things that we really recommend is that your HRC actually have a policy, and it doesn't have to be fancy, but a simple mission or value statement. So it's clear to the people on the committee, and it's also clear to the organization and the people coming to the committee, what is the role of this group and what are the responsibilities and how are they going about fulfilling those. And this is where you have an opportunity to really set the stage for the committee to have that broader focus of protecting and promoting rights, not just to be a committee that's reviewing and approving restrictions. You want to be looking at the abuse, neglect, exploitation, mistreatment allegations, and figuring out a good way to do that within the confines of your systems. You obviously, one of the huge roles is around confidentiality, and going along with that is ensuring informed consent. And informed consent is you really make a commitment to spend time with someone to help them truly understand what it is you're talking about. We do have an informed consent for the personal outcome measure interviews that you might want to take a look at. That's on our website, just as a way to look at some plain language, some pictorial kind of representation, to really go beyond just having a piece of paper that somebody signs. So you want the committee to be providing due process for all the rights restrictions. And when we talk about that, we're talking far beyond just the behavior support plans that you might typically look at. We think about restrictions in a very broad way. So there are restrictions that you probably don't even think about as restrictions. You know, if you've got people have house rules in their home, that's a restriction. If things are locked up, those are restrictions, or people have no ability to access their food. That's a restriction. So there are lots of restrictions that might be going on, and that might be a role of your committee is to help educate folks and to really be ferreting out all of the restrictions that you want to be providing due process for. And the committee, their role is to act as really advocates for reducing, eliminating restrictions within the organization as a whole, and to help the organization as they are reviewing proposed restrictions. It gives them kind of an insight, a bigger picture about what's going on within the organization, and to help organizations figure out how to avoid restrictions to begin with. And really at the very base of the HRC is about a place for people to be able to exercise their rights. So in order to understand roles and responsibilities, the members of the HRC need to have training. They need to know what their roles are. They need to understand the values. They need to be very clear about the process, the expectations, the requirements, what their roles are, the responsibilities, which goes back to having that policy, that mission, that vision, and really having it lined out in terms of what the committee is to be doing. So some more specifics about what the committee is to be doing is to ensure rights are not ignored, that you're wanting to ensure the organization is respecting individual preferences and looking at positive approaches, helping people learn about how to exercise their rights, helping think about beyond this notion of managing behavior. An important part of a committee and a member on a committee is presuming competence. And many of you may have already seen, Seth's going to drop in the chat box a link to a little short 5-minute video about presuming competence and the impact that can have on people's quality of life. So a Human Rights Committee member and the committee as a whole needs to have a checklist of what do we have to ask? What are essential questions that need to happen as we go through our meeting? And the committee and members need to develop a system for what I call closing the loop. So ensuring that you have a way to track what's been brought to the committee and then the follow-up. So there may be things that come to the committee that are approved, and you want to ensure you can see when they're supposed to be back for review. There might be requests that are denied, and recommendations from the committee are given, and the committee should have a way to be able to follow up and know those occurred. There may be situations where the committee doesn't feel like they're able to make a recommendation for approval or denial. They need more information. And so again, you need to have a way, a system for ensuring what was asked for comes back and that the committee is able to look again at that information. So when you get to the committee meetings, so it's really important. You need to have meetings often enough for the number of people that you support and the number of potential restrictions that might be coming through. You don't want that to hold things up. You need to ensure meetings are at a time when you can get the committee members there, as well as at times for the people whose rights are being considered to be restricted. They need to be an active part of this process. And so they need to be invited, encouraged, supported to participate in the meeting. That can't happen if the meeting always happens during business days in the afternoon, and that's when that person works and they have to take time off work in order to come. So you're really thinking about how to make these meetings accessible. You might rotate meetings in terms of location. You might rotate meetings in terms of time. You might, as one of the other slides talked about, have a couple different committees. So they're really just needing to make sure that you're doing what it takes to ensure that you have an active, engaged committee, and that the people that you're wanting to participate can get there. So you don't want people to have to be making a decision to leave work or some other scheduled activity in order to come. You want to make sure they can get to the meeting, they have transportation. Now, of course, life as we know it today, you may not need to worry as much about transportation. You may be able to connect virtually, which may open a whole new world of participation. You want to make sure that the committee has a structure that includes minutes and that there's a format for those minutes, that those are taken, that they're comprehensive. So you know what the discussion was, what the concerns might be, the recommendations might be, the questions might be. And then again, those will serve you well in terms of wanting to be able to close that loop and follow up. You'll be able to use those meeting minutes to help you do that. One thing that is helpful is if you figure out what works well for your meetings, to calendar that out for the entire year, so that can get on people's calendars, which will reduce the times that people have to bow out. So, and then one of the other items here is really helping people understand why they're being invited. So you may have a situation where you say, well, we invite people, but none of them want to come. Well, do they really understand what's happening? Have they been supported to feel comfortable about going? Some people, maybe going to a meeting like that is not their cup of tea. So maybe you're able to help them go over the proposed restrictions and think about their input and have a way to carry that input, whether it's written, whether you get them on and do a little video and share that with the committee. So there's lots of ways to help people be involved in a way that's comfortable and useful to them. So let's talk about, when you're at that meeting, what kind of questions should members of the HRC be asking? So I'm going to give you a minute. You're sitting someplace, scribble down on a piece of paper some questions that you think are important, or in your experience being on a committee have been important. Take a minute, because I've got some slides that we're going to go over and look at some questions. And then at the end of those, I'm going to ask you to share questions that perhaps didn't get included that you think are important. Okay, so take a minute, scribble someplace. Okay, so I'm going to launch into my questions that we've come up with, and they're not in any particular order or priority or importance or categorized. So sort of keep track of what you think is important and see if we touch on it. So why is this restriction necessary? Asking that. What's been done? What's the purpose of it? Why is it important? What are the ramifications if it's not implemented? And what are the ramifications if it is? What have you tried before? Because there should never be a restriction that comes to the committee where more positive options have not been tried. Have you helped explore with and for the person whether there are other factors, medical, mental health, environmental, that might actually be impacting this need for a restriction that could be taken care of without a restriction? Have you really explored with and for the person what you think they're trying to accomplish or communicate in whatever situation is causing the need to consider restriction, what kinds of other kinds of training and support have they gotten, education strategies, that sort of thing. And you're going to want to know if this restriction is approved, what sort of training and support is going to be in place to remove those restrictions. How does the folks that are coming to present that, how are we to know that this is really the least restrictive way? Sort of gets back to what else have you tried? What have you explored? What's the criteria for helping people restore their rights and eliminate this restriction? There should not be restrictions that are just blanket restrictions and just every year you just check the box and move on. There should always be a serious consideration about what can we do? What data are you collecting? So in order to know whether what you are proposing and if it gets approved that you're implementing, how do you know that it's actually working? What kind of data? What kind of data did you collect about the other options that you tried so that you can have an informed decision as you're looking at that? What's the time limit for this restriction? And when is it going to be reassessed? And how is it going to be reassessed? Really asking the hard questions about informed consent. So what's been done to ensure that the person impacted by this has had true informed consent? Even if they have a guardian, you need to be making sure that the person understands as well as whatever legal representative they might have. And who has been helping them in terms of the informed consent. And if this restriction is approved, how are the people who are going to implement it going to be trained and supported and provided oversight? How has the person been involved in the process from the very beginning when an issue was identified where extra supports were needed and things have been done and now you're at this place of asking for a restriction? How has the person been involved in that process? And the committee should be asking, if we approve this restriction, how does that affect other people who are living or using the same environment that this person is? You know, kind of a classic one example is if you're saying you need to lock up all the knives, how does that affect the other people perhaps that this person might have for housemates? But it can cross a lot of variables. So what kind of dangers or possible negative consequences does the restriction present? So most often we come and we can present why we think the restriction is important, and these are the dangers and negative consequences if the restriction isn't put in place. But what are possible negative consequences if the restriction is put in place? And that follows right into that next question of, ultimately, what is the impact on the person's overall quality of life? Does the restriction actually help us to support a person to have a better quality of life? So those are sort of our top, I didn't count, our top 3 slides worth, our top 20, top 100, whatever they are. So I'm curious to see in the Q&A box, are there any questions that we don't have on our slides? Any questions that we missed that you would suggest that we want to? How does the person involved feel about the restriction? Tina says, excellent. Is this restriction for the person's need or the staff's convenience? Excellent question. Is this related to a physical need? And will that physical need change or get better? So that's back to that, really looking at all the factors, medical, physical, environmental, kind of how that's going to, what other alternatives have been tried? Oh, I like this one, Kayla. How can the person be more supported emotionally through the restriction? So if the restriction is approved and it clearly has an impact on the person, how are you supporting them through that? Is there a fading component, and is it obtainable? So that's where that's talking about restoring people's rights and figuring out how to get rid of this restriction at some point. Has there been communication between doctors to ensure that medications that people are on are not contraindicated, or so that there's a team approach to that we're not causing issues by multiple medications and side effects and those sorts of things? Great question. How does this benefit the person? We've been talking about, how does it not hurt the person, but how is this a benefit? And that goes back to that. What's the impact of on the person's quality of life? And great question, Diane has, how long has this restriction been in place? How many times has this restriction come back and back and back? Have there been other sorts of quote unquote replacement behaviors indicated? So if it's the type of restriction that's trying to support people to stop doing something, are we helping people find ways and other things to do? What, if any, is the imminent risk? Is this committee overstepping its role by whatever this requested restriction is? Wanting, as you're tracking as a committee over time, is if a medication change was indicated, is that working, and has that made a difference? So has the individual been educated, supported to understand whether improvements are being made or if circumstances are changed, and how restrictions might be adjusted, reduced, eliminated? Great questions. I'm gonna move on, and there's some other questions in the Q&A box as well. We'll get back to those at the end. Thank you so much for all of your input. Wanted to cover a couple more things, and then we'll have time to chat further in general questions. So if Seth's furiously trying to keep track of the ones we answered, and if we don't get to yours, we'll encourage you to make sure you let us know. So we just wanted to throw in a few things for you to think about as a committee, of things that would indicate to you perhaps your committee's not on track, or that it maybe needs some support to improve. So if there's not been any training for members of the committee, they were asked or they volunteered, said great, gave them the time and the date, and they showed up at the meeting. So that would be a danger sign. I sort of chuckle about this because I don't see this happening anymore. We certainly have in the past, but if the executive director of the organization is the chairperson of the HRC, that would be a danger sign, okay? So you're wanting this to be a more objective, third party, more impartial view, and a support and an advisory capacity to the executive director. If you never have anybody whose restrictions are being considered, if none of them ever come, if you can look at your minutes and you don't ever have anybody, you really need to kind of think about, do some soul searching as an organization about how that information is being shared with the person and what kind of supports are in place. If your committee has a huge number of restrictions that are getting reviewed at each meeting, that is a warning sign for you. It means that you need to have meetings more often You need to consider about why you've got so many restrictions. Now, that may all be legitimate. It may be that you're in a large organization and you're serving lots of folks, but so that's a warning sign. You don't want to see that happening. So if your committee has there's no policy about the Human Rights Committee, and there's no clear outline of what their roles and responsibilities are, that would be a warning sign that you'd want to take a look. If you have members who have a feeling or are verbally sharing that, they just don't want to be critical of the staff. They know how hard the staff are working. They know how much the staff care. If you have members who are saying things like the professionals know best, the whole point of this committee is to have a wide variety of people and to have somebody outside the professional realm, hopefully, to be able to have that input. If almost all the restrictions that are brought to the committee are approved, you want to take a look at that. That may be a warning sign. I mean, it could be that you don't bring very many and everybody's well-versed in how you're doing a great job of supporting people to not have restrictions, but it's just worth taking a look at if almost all of them are approved. If there's not much discussion and not much of that discussion ends up in the meeting minutes, might be something you want to think about how things are going. If the committee very rarely asks for additional information or says, I just don't think we know enough to approve this right now, could you, find out ABC for us and come back? If you never see that in the minutes, if that's not happening, then probably, again, time to take a look at what's going on with your committee and how well it's functioning. And of course, as we talk about these things, this is all, best practice, best things to think about. We know that life happens and you're gonna, do the best that you can, but as with everything with CQL, I guess it's so important to us is we want to help you figure out where you are and what's going well. And then we want to help you figure out where you want to be. That there's always room for improvement and there's always room for self-reflection to look at how you're doing things. So before we jump into questions, just wanted to make sure that you know that there are resources out there, and these are just a few. We can't speak highly enough about Steve and Amy's book. Very, very, very useful. There's some articles, newsletters, that sort of thing on our website. We want you to know, because some of the questions that you come up with that we may not get to, you may want to join us in October. So we have, I'm very excited. What we've done is we have invited a variety of folks from different organizations. We've got 3 different states, a couple other countries, and we're just going to be having basically conversations with them. And we have specific topics, things that we've discovered that they're doing well that we're going to talk about, but we'll also have time for more general questions. So, we have an organization who's doing a good job of supporting people served to be on the committee, an organization that's doing a good job of involving people served in the whole process. We have a couple of organizations who've created other committees that interface with the HRC committee as they saw other things in their organization, other needs and fascinating things. And then we've got folks who, transformed their HRC. They started one place and have just done marvelous things in terms of bringing it to a better place, a place they want to be. We've got an organization who's had an HRC for a very long time. So how they're going to share with how do they keep that fresh? How do they keep it operating well and engaged? So I'm very excited, as you can tell probably. So hopefully that you'll all join us in October for that. And we always want to make sure that we've got resources for you, how to find them. We don't send things to you unless you ask for them. So at the bottom of every one of our web pages, you can find the way to sign up for what you want. Lots of ways to stay connected. We're always encouraging people to use the e-community, to use each other and your expertise, and people are always very, very willing. So I've got a question for you, and then we'll look at your questions. So I'm curious to hear from you about, we've spent 45 minutes talking about HRCs. Is there something that you learned today? Was there like an aha kind of thing, or just a little nugget that you're so pleased that you walking away with? And then what you might be thinking about doing as a result of investing this time today. So I'm going to start at the top of our questions, and I won't get to all of them. And there's a couple actually that I'm not sure I understand, and so I will try and follow up with those folks separately. A question is, do you know of any resources for organizations currently seeking committee members? I would say a couple of things. We've seen some people be successful at joining forces with another organization, and having a combined HRC is one resource. Feel free, if you're on the webinar and you have a resource for organizations, feel free to throw that in there, and I'll try and share. A question about why you would want the committee to review substantiated allegations and looking for outcomes. It's really looking, I mean, there's a lot to that question, but on a very brief response is really looking at trends and timing, responses, and ways or warning signs for the organization as potential ways for improvements in that system. So a lot about the trending and how you might be able to use that strategically going forward. Obviously, most, if not every one of you, have a requirement for incident reporting systems in your governing entities. So it's not talking about taking the place of that. There's a question about, considering that HRCs are advisory committees, what avenues do they have to enforce their determinations? Like if they don't approve a restrictive intervention. I think that would be one of those warning signs, if that's how you're feeling on a committee, that having that conversation as a committee and with the organization, going back to what's our role and our responsibility, and talking about that scenario. So what's going to happen if you bring us a desired restriction and we say no? What are you going to do, and how are we going to interact? So you could actually set that process up ahead of time. Great question. There's a question that says, can a guardian restrict anything? And the answer is that's very complicated and depends on the guardianship and the state or the country you live in. Most guardianships are quite specific, and you can read the papers that will talk about it. There's limited guardianship, full guardianship, and of course, we're all delighted to have supported decision-making as an option, and certainly actually enshrined in law in many places now. How do we ensure a wider view on rights promotion and prevention and not get bogged down with just responding to complaints on restrictions? So that goes back to, I feel like I'm sort of a broken record, of really looking at what's the point of our committee and getting buy-in from the organization that is a role of the committee, and having champions. Talked about having that liaison or advocates from the organization who really are wanting the committee to grow in that role, And so I think it's very much a part of being able to, if that's something you want to do more of, it would be a good way to start and say, you know, I went to this webinar and it says we should have some mission and vision and all of that. And you could say, let's talk about it and see if you can get some, generate some interest and some excitement around that. It says people whose restrictions are reviewed are encouraged to attend the meeting. However, we are also supposed to keep things confidential. And what's the best way to do this? Well, what needs to happen is that the person whose restriction is being reviewed is the only person there whose restriction is being reviewed at that moment. So you might have somebody sitting outside in a waiting room. You might schedule them at different times to come to the committee. And because you obviously have been working with the committee members about their responsibility with confidentiality. So I would just say you'd schedule that or have kind of different places in your building or wherever you're meeting. How do you decide what's too large a number of restrictions? Thanks for asking. If you're meeting, you know, you set a certain amount of time for your meeting, and you've run through and you run out of time. If you have, I don't have a magic number, I guess, Katie. I think you need to take a look and say, the notion about having too large a number is all around, are we taking time? Are we doing our due diligence? Are we really asking all these questions? So if you're asking all those questions, you're not going to be running through a bunch of restrictions. So, so there's some very great questions I don't necessarily have an answer to, or we don't have time to get to. I will follow up with you individually. So things that people are taking away from today, how important it is to train the members of the committee. They really like the idea of reaching out to students who are studying in the human services field as potential committee members, that was useful. This person's going to go back and say, take it to their HRC and encourage them, sounds like. And this person, kind of their aha was that realizing that they've lacked a focus on making sure that that person who's being affected is invited and attended and supporting. And they noted it feels like to them that they've failed at nothing about us without us. So it's always a good reminder. This person looked at, learned that their committee is doing great and is doing the things, and that they're going to look at the danger signs just to double check. Legal guardianship and rep pay in terms of human rights is what somebody listed, I think, as a learning. Those would all definitely be restrictions. Guardianship has its own legal due process, although we absolutely believe that you should be supporting people to look at all their options for decision making. But rep pay is definitely a restriction around your money, and we would say that human rights committees should be looking at that. And one of the committees, one of the organizations that's coming in October is going to talk a little bit about that. So there's lots more. I'm just incredibly delighted with all of your thoughts and questions, and there's so many questions that we will figure out, because there's so many. I don't know if I'm just going to email you individually or if we're going to, Seth and I'll talk about that, so that we can help out with this. Time is up, and so I don't want to keep you. I appreciate you being a part of our time together today, and look forward to hopefully seeing many of you in October. And like I said, with so many great questions, Seth and I will talk about how to respond to you and engage with you. So I really appreciate you being so engaged. Thank you.